Irvine Division of Geriatric Medicine and Gerontology and our Geriatric Workforce Enhancement Program. So thanks so much for taking time out of your day to join us. We have a lot to get through, so we're going to go ahead and get started. So I know we'll have people joining as we kind of start our intro slides. So if you have joined, you will be on mute only. If you have any questions along the way, feel free to unmute yourself. If this is not your first ECHO series with us, and this will look familiar, this is the structure of our ECHO session, starting with announcements and introductions, followed by a 30-minute didactic. And today's topic is going to be focusing on cognitive impairment, the basics. And then we'll be moving on into our collaborative case discussion with a wonderfully complex case submitted by one of our physician participants, and followed by closing reminders. As I mentioned, you are on mute, and just make sure if you do have a question or want to be involved in the case discussion, just to unmute yourself and introduce yourself prior to speaking. Always maintain confidentiality when speaking about patients. Refrain from including any identifying information. Thank you. We are CME accredited, and our main objective is to educate community and rural healthcare providers in age-friendly geriatric patient care, treatment, and management. And today's session is accredited for 1 CME credit. So if you attend all sessions in this series, you will receive 5 CME credits. Certificates will be sent out by our CME office at the end of the series, and will outline the total number of hours you attended. And then many other licensing boards, like the California Board of Nursing, also recognize the CME for reciprocity. Just letting you know, this project is supported by the Health Resources and Services Administration of the U.S. Department of Health and Human Services. And then this information or content and conclusions are those of the author and should not be construed as the official position or policy of HRSA, HHS, or the U.S. government. So we usually like to have everybody introduce themselves. We have quite a few on the line. So I'm actually going to ask you all to please type in the chat your name, your role, your site, and location. We love to see, who's joining us today and from where. It's always wonderful to see, because I think you guys all come from all over the U.S. and even sometimes abroad. But we will go ahead and have our hub team introduce themselves on video, so you can get to know us. I'm the project manager for my Geriatric Workforce Enhancement Program at UC Irvine Health. And my name is Nika Seville, and we're located in Orange County, California. So I will turn it over to Dr. Sagal.
Welcome, everybody. I'm Sonia Sagal. I am a clinical professor in the Department of Internal Medicine and Geriatric Medicine here at UC Irvine. And it's really my pleasure to welcome you all to our ECHO session.
Thank you, Dr. Sagal. Dr. Campbell.
Hey everyone, my name is Dr. Sarah Campbell, and I am a clinical assistant professor in the School of Nursing here at UC Irvine. I'm a family nurse practitioner, and I teach in our DNP FNP program here, and happy to be here with you all today. Thank you for coming.
Thank you, Dr. Campbell. And Dr. Gurvich. I think you're on mute, Dr. Gurvich.
Hi, I'm Tatiana Gurvich. I'm a clinical pharmacist. I'm a professor at USC School of Pharmacy, where I teach geriatrics, and my primary care site is at UCI Senior Health Center, where I've been since 2007. Welcome.
Wonderful. Thank you all so much. That is our main hub team. Thank you all for introducing yourselves in the chat. I see someone, a PGY3 student from Puerto Rico, someone from Long Beach. Have Ali Kripa from UCI, Monica Osborne from Montana, Spring Lake, North Dakota, UC Davis, quite a lot of attendees from all over the US. So thank you guys so much for taking the time to join us today. We want to make sure that we get to everything today. So we'll go ahead and move on into our didactic, which is going to be presented by Dr. Pereira. She's joining us today. I will let her introduce herself. Go ahead, Dr. Pereira.
Oh, thank you very much, Nika. Hi, everyone. I'm Manisha Pereira. I am a geriatrician. I work here at UC Irvine Health at the Senior Health Center. And I do have a background in internal medicine as well. And very excited to have this discussion and this topic, discuss this very important topic with you today. Shall I go ahead
and
get
so
started?
yeah, Dr. Pereira is going to give us the presentation today, but if you have any questions along the way, please feel free to chat, put them in the chat, and we'll try to get to them after the didactic or after the case presentation. We'll go ahead and get started, Dr. Pereira. I'll move the slide forward.
Thank you. So before I get started, I just want to make an announcement that I do not have any financial disclosures regarding this topic. And next slide. So today I want to highlight 3 key points regarding memory loss and cognitive impairment. And that is that it is more common than you think. Screening tests are relatively simple and quick to administer. And I want to talk about the 4 most common types of dementia that we see in our clinical practice. Next slide. Our population is aging. By 2030, it's estimated that 21% of our population will be over the age of 65. Next slide. And by 2060, this is estimated to increase to 1 in 4 that will be over the age of 65. Next slide, please. This graph highlights how our demographic is changing.